Anal fissure is often overlooked or uncomfortable to discuss openly. Anal fissure has more pain and the pain will be severe in sometimes for a long time. Conditions like anal fissures can cause more discomfort in their daily life. It is more vital to understand the anal fissure causes, symptoms, and effective management. Anal fissure is also known as fissure in ano. The anus is the muscular opening at the end of the digestive tract where stool exits from the body. Anal fissure is a small tear or cut in the lining of the anus. Fissure in ano can occur at any age. Fissure in ano are most common in young adults and middle-aged individuals. Anal fissures often develop due to the stretching of the anal canal during bowel movements, especially when the stool is hard or large. The following reasons are the main causes of anal fissures, such as chronic constipation, diarrhea, obstructed defecation syndrome, penetration, and even when women pushes heavily during the childbirth that leads to anal fissure more often. There are some other factors that causes fissure in ano are undergone any anal surgery in the past, sexually transmitted diseases, irritable bowel syndrome, even diaper rash can cause anal fissures, and more on. Fissure in ano is so painful and the pain often described as a sharp, burning sensation that occurs during and after bowel movements. The pain can last up to several hours. Signs of anal fissure are cracks can be seen in the skin around the anus and bright red blood on toilet paper or blood in the stool, and the symptoms are like itching, irritation, and muscle spasms in the anal area. Identifying the signs and symptoms are more important to seek an appropriate medical care. You should seek a medical attention immediately when you feel more pain and discomfort that persist or worsen. A physician can accurately diagnose the condition and recommend for an appropriate treatment. It is essential to address anal fissures promptly, as they can affect your daily activities and well-being. Fissure in ano sometimes can be managed a combination of self-care with lifestyle changes, but medical intervention is required if the conditions are worsened. Anal fissures are identified as acute anal fissure or chronic anal fissures. Acute anal fissure looks like a fresh tear. But a long-lasting, also called chronic anal fissure likely has a deeper tear. It also may have internal or external fleshy growths. Leaving chronic anal fissures untreated leads to perpetuation of themselves in a vicious cycle that causes continued injury to the anus instead of healing. See a doctor if you have a chronic trouble in bowel movements or unexplained pain in the anus. Treating these conditions sooner can prevent complications like anal fissures from developing or returning. Homeopathy is highly effective and recommended in treating all forms of fissure in ano. It is possible to avoid surgery in many cases of fissure in ano when homeopathic treatment is administered at the proper time. The right method of homeopathic treatment facilitates healing and improves blood circulation to the anal mucosa. It also relieves you of the anal spasm and gives relief to the pain. Homeopathic treatment corrects the underlying disturbed digestive system and aims at treating the underlying causes and its symptoms. Homeopathic treatment is completely safe and it should be considered as the first line of treatment for fissure in ano to avoid surgeries. You can contact Dr. Sheela Homeopathic Healthcare Clinic at 9500049892 for fissure in ano or anal fissure treatment and for the definitive cure.